Welcome to the Illuminators, Changemakers in Senior Living, the podcast that explores the past, present, and future of senior living through the eyes of those who are transforming it from the inside out. I'm your host, Matt Mauthe, Chief Executive Officer of Illuminus, a faith-based, not-for-profit that aims to transform senior care for the better. Join me as I seek to reimagine the aging experience through an ongoing dialogue, where together we'll shed light on current issues and shine a light on a brighter tomorrow. Hello and welcome back. Today I'm joined by Lynne Wagner, a longtime nurse in long-term care, and we're going to spend the next few minutes talking about your career, what got you into nursing, and hopefully share some fun stories along the way. So thank you for agreeing to do this.
You're welcome.
I've been looking forward to it.
I know.
So just start and share with us how you decided to get into nursing.
The career start. Certainly it was a little slow coming out of high school. I had gotten a scholarship actually for technical college. So I was way in a different direction, but graduated and felt I really needed a career with some teeth and future. So started studies for nursing, UW-Madison, Marion College, and then landed at a 3-year hospital school of nursing in Milwaukee, Deaconess Hospital. It doesn't exist anymore, and those 3-year programs, unfortunately, went by the wayside.
Yeah.
And graduated as a registered nurse in 1980.
Okay.
Yeah. I wanted to work with the elderly.
Mm-hmm.
There was a clinical nurse instructor. We hit it off, and I was the only one who volunteered for taking care of the older adult.
And you knew you wanted to do this in nursing school?
Yeah.
Okay.
Yeah, it was that clinical experience. You know, they have you go and do a lot of different types of nursing during the school. And so I knew it. And I was the only one who volunteered to take care of older patients after graduation. And it was a neurointensive floor. We had a lot of stroke patients, anybody who had a dementia issue coming off the street landed on that floor, brain issues, spine issues. So then, as I shared with you, I was the wife of an Army officer. Mm-hmm. And shortly thereafter, in 1982, we went to Germany. And there are no, I couldn't get licensed in Germany.
Yeah.
So I ended up managing an officers club over there on base. Finally got back to the States, and I decided I was going to get my Bachelor of Science degree in nursing. Sort of opened more doors for that nursing career. And worked part-time home health at Watertown Hospital, had a home health then.
Okay.
So I worked part-time there with Cheryl.
Okay.
And then when I graduated and had that degree, I needed to work full-time. And there was an ad in the paper for an assistant director of nursing at the nursing home that was next to the hospital.
Okay.
It's a for-profit.
Yeah.
I had no idea what I was getting into. None.
And when you went back to get your bachelor, was that an additional year?
It was all because I had to work part-time, be a mom part-time, and then go to school part-time.
Yeah.
Yeah.
So it took a little longer.
It took a little longer, and I was so thankful. I went to UW-Madison, and I said, I don't want to take care of, don't give me clinicals with babies, pregnant moms, give me the older adult. And they gave me a wonderful clinical experience with the VA and UW.
And what do you think attracted you to working with older adults?
It really, it just, it was comfortable.
Mm-hmm.
It just was comfortable, and it was all encompassing, you know. There's med surge, there's psych. The only thing you're not doing is taking care of babies.
Yeah.
But you can apply all of your clinical knowledge
Right. And
into that older
so
adult.
did you think that you would end up spending your entire career
No,
taking care of older adults?
Well, that's where my comfort level lie, and that's where most of my education was focused. You know, at the VA hospital, a lot of their clinics, you know, the incontinence clinic, the falls clinic, it was such a great experience. And then being able to apply that in practice was wonderful.
And what year did you begin working for Illuminus?
For Illuminus in 1999.
And so tell me a little bit about how that happened.
Again, I was out of state. We were assigned out at the Pentagon.
Mm-hmm.
So I was working in Virginia.
Okay.
And he retired, and we moved back to Watertown, and I needed a job.
Yeah.
And there was an opening for a PM supervisor at the Marquardt, and I accepted it. And probably within the year, they needed a director of nursing.
Okay.
That's my start.
So then you took over as the director of nursing and had about 30 nurses working for you?
Oh boy, 140 residents, and we were often quite full.
Yeah.
I don't know how many nurses, but quite a few, and CNAs.
And so over the years, what did you enjoy the most about your role or the roles that you had?
Taking care of the staff and taking care of the residents, certainly,
Yeah.
and their families. You know, I remember at my retirement, I told my kids, I said, you kids, you can never call me unless you're bleeding or dying because I'm busy.
Yeah.
And I'm busy making 700 people happy
Yeah.
and taking care of them.
Yeah.
They accepted that out of their mother. It was pretty nice.
So I want to talk about that a little bit, the demands of being a manager, a director of nursing in long-term care. Let's just talk about the good, the bad, and the ugly for a moment.
Yeah, they are great. And, you know, when I accepted that ADON and then it turned into a DON position initially at the first nursing home, I didn't know what I was getting into. And I think within a week of starting, there was a survey that was occurring. No clue. So much learning on the job.
Yeah.
And studying. I think education, you know, never stop.
What, from a regulatory standpoint, just talk about some of the changes you saw over the course of your career.
Yeah. I was reflecting on that a lot, actually. And you know, when I left, I had the survey process had dealt a gut punch.
Mm-hmm.
And it didn't feel good at the end of my career.
Because of over-regulation.
The process.
Didn't allow nurses to be nurses.
You know, I used to be able to, when that process was ongoing, I used to be able to have conversations with them.
Yeah.
The surveyors. We would have those conversations, and it would be logical and made sense. And we'd have this dialogue about what was going on in the facility. And that doesn't happen anymore. They, when I wanted to engage them in some of the things that we had done that were positive and improved the quality of life for the residents that were living there, they didn't want to engage.
Right.
There was no conversation.
There's been a lot of change.
They don't want to hear it.
Yeah.
And that's a hard change to accept. because you pour all of your heart and soul into making sure that every resident's care is wonderful and perfect,
Right.
as perfect as you can make it.
Just share with me the importance of relationships with the families that you interacted with, the residents, the staff, providers in the community.
Those relationships started and stopped as I moved about, but it was very, very easy to reconnect coming back. Hospital staff, our partners in the community, and it made it a smooth transition.
And how
was
meaningful was it for you to be serving in the community that you had grown up in?
It was wonderful. I felt a lot of pride and joy being able to work there.
Yeah.
And then I was working side by side sometimes with family
Yeah.
and just getting to know everyone again.
Yeah, lots changed over the years. Back then, the residents stayed for a long time. You got to know them well and their
Yes.
families,
Yes.
which was fun.
And
Lots
I
of hugs.
still, to this day, there are still family members that I see out and about, and we remember.
Yeah. So I want to talk a little bit about your connection to your staff, because you've been retired for a while
Yes.
and you've been out of managing long-term care organizations, but you have a very close relationship to a lot of your staff.
I do. You know, we cross paths with each other.
I know yeah.
Absolutely.
And so how meaningful is that to you to have managed these staff, work side by side with them for many, many hours a week to maintain those relationships into retirement?
It's important to me because I want them to know even today, even though I'm not their director of nursing or their boss,
Yeah.
that I still care about them and I still want them to be successful. I hope they're still working there as much as they can. We need good staff.
Yeah.
And we had and I had the joy of having wonderful staff.
Yeah. I want to transition a little bit into, because you left our organization for a while in between working for Illuminus and Commonheart.
Yes,
And
it
I
wasn't very long.
I told you you could take the summer off, but that was it.
Yeah.
And then I said, then you got to call me and
You were.
when you're ready to come back, and you did call. And then you began working for Commonheart, which is our home health and hospice.
The home health.
Yeah.
And I started as a home health nurse, part-time.
Early in your career. Oh, when you came back to Commonheart.
Back.
That's right. I forgot about that.
Yes,
Yeah.
yes. No, I was a home health nurse and they needed
That's
somebody
right.
to make some of the visits.
Yeah.
Now, home health was, at that time on campus, 30 clients.
Right.
30. And we dare not go outside the city limits.
Right.
Look at where you are now.
Yeah. Yeah.
Look at where, after, eventually I transitioned into the intake specialist. And all of the counties.
So I want to just talk about that a little bit.
Unbelievable.
When you were in the director of nursing role, your focus was on taking care of the patients. But when you transitioned into home health, into the intake nurse, it was more of taking care of the staff. And so I'm interested to...
No, it was really, what was, I think, very important was to take care of my customers.
Yeah.
I can't tell you how many times I picked up the phone and it was a distraught social worker at the nursing home and they needed to do discharge planning and they needed help. Or it was the social worker at the hospital.
Right.
Trying to do discharge because the pressure's on, get them out of the hospital and give them quality of care. That was very enjoyable. Letting them know that I cared about them. And there's a way you can do that.
Right.
And they felt it, and then everything was going to be okay.
And how many years did you work for Commonheart?
Until 2013, and then I retired in 23.
So now I want to go back and talk. Lynn's had a major influence on my career, which I think you know, and so I want to talk
Tell
about
me
some of
about
these.
it. Tell
Well, I
me
know I
about
want
it,
you to
Matt.
tell me about some of these. So I think it'd be fun to. Do you have any recollection of when I started at Illuminus?
Well, you were an intern,
Yep.
and at the time, the interns from the university had to go through each department.
Right.
Now, as I recall, and correct me if I'm wrong, when it was my turn to have you, we survived one day because the surveyors walked in.
That's right. Yep.
And then you had to go right over to the administrator and learn that
Yep.
experience. And I don't know that we ever got back together in the teaching sense.
Yeah.
Or
We did later on.
did we?
And then probably more so when I came back, because when I started as a staff member, it was in 2010, and that's when
Okay.
I was the CEO and the administrator. if you remember.
Administrator, yeah.
But here are some of the influences you've had, and I want to talk a little bit about this, especially
Sure.
from just the way you worked with staff. So your philosophy always was, I need to be present and
Yes.
visible to the
That
staff,
was very important.
which meant that you were there no later than 6 in the morning because of shift change,
Right.
and you
needed
stayed
to make
through the PM
rounds.
shift change.
Yeah.
And so just talk a little bit about kind of your philosophy on that and being present for your staff.
You know, it's important that I demonstrate what I expect
Yeah,
and am there and available for the staff. But there were always opportunities to teach them. So whether I'm just out there and doing rounds, you're learning what I'm assessing
Yeah.
and identifying, and we're having an exchange. It was really more the demonstration. This is what I expect, so why wouldn't I do it?
yeah, yeah,
Yeah.
yep. I mean, you were tough but fair, and that's what gained you a lot of respect.
Yeah.
And you were visible.
Yeah. Now, these are staff that when I waltzed in, you know, many of them had already been there for 20 years. And
Right.
that's a tough road because first you have to listen to them say, this is how we do it here.
Right.
But you have to have that evolution and change. And kindly, this is how we'll do it now.
Right.
And how you get there is huge.
Yeah. I think the other thing I always appreciated is you were willing to roll up your sleeves and work
Yes.
right alongside your nurses.
That's when I was happiest.
Yeah.
They needed the education. You know, I came with a lot of specialized assessment skills that they didn't have, but they needed in order to survive. And I think the demand from a regulatory standpoint is huge, that these nurses operate at this level.
Right.
And many of them haven't had the opportunity to have the education.
Yeah.
They need it.
Yeah.
They need somebody who can do that and support them. It's hard to get somebody, you know, to encourage them. Read your professional journals.
Right. Yeah.
Do things on your own.
On your own time,
Yeah. You know, I did the certification for gerontological nursing. Huge, awful testing. Awful. But it made a difference. You learn.
Right. And we had fun along the way.
Yeah.
You
Yeah.
remember when we'd bring the cows and a horse and a donkey and a duck through
For
the
state
nursing
fair.
homes for state fair?
Yeah. We had a real state fair.
I had to bring all the animals through the building because the
Yeah.
courtyard had no
And the
external
hay
entrance.
and everything.
Yeah.
It was
And
fun.
so did you ever, I don't remember, did you ever dress up for Mardi Gras or Halloween?
I was a witch, and
For,
I made
for
children
Halloween?
cry.
Yeah, okay.
Yeah.
What about Mardi Gras? Did you
Trick-or-treating.
participate in
No,
that?
no, I didn't.
Do you remember the dragon we used to have, and we'd have like 10 staff under the dragon?
Yes. Going through the
Yep.
halls. Oh, you have a better memory than I do.
Do you remember what I dressed up as the one year?
For Halloween.
Ann Fisk and I?
For Halloween.
For Halloween, yeah.
No.
I was a priest and she was the nun.
Oh. Yeah. Yeah.
We
We had fun.
And the residents had a lot of fun.
Yeah.
And that's what we did it for.
Yeah. It
Yeah,
was.
those great times together.
Mm-hmm.
So now I want to talk about your time as a board member, because you've recently just joined our board within the last year. You and I have known each other for a long time, and as we've talked, you've had a huge impact on my career, my own career, just kind of how I go about my day, how I interact with residents and families, and that stuck with me. And as you transitioned in retirement, as you know, I don't let anyone just fully retire. I told you, well, there'll be a role for you in the future.
Sure.
And in my mind, I was thinking at some point of asking you to join our board.
Sure.
And for a very strategic reason. You have a very different perspective than many of the members that sit on our board. Many of our board members have financial backgrounds.
Right.
And I want to get your thoughts on, what that means to you.
Well, it was such an honor to be asked to consider it, truly. But in my own brain, in my mind, I thought, Lynne, what are you going to be able to contribute here? You're a nurse. These are all businessmen. You're surrounded by bankers and businessmen, although the pastor is female. But I haven't quite figured out how I'm going to contribute the best. Going into the meetings, we're just under a year. Going into the meetings, certainly I read everything, the minutes, pay attention, learn how the organization Illuminus has grown, how Illuminus takes care of and enhances the services of so many elderly people in Wisconsin and elsewhere.
Yeah.
And then I look at retention rates, things that I truly understand, the quality measures, the retention rates.
Right.
Those are important to me. But the actual impact that I might...
You haven't felt it yet.
No.
It's coming.
Now
it's
I
coming
told...
as we get the dashboards up and running.
Yes, that'll be helpful.
And the quality metrics. And you bring a completely different perspective that's so incredibly needed in our organization as we continue to grow, and that is from the clinical perspective, the quality outcomes that we expect, and just how we go about caring for patients. And so we're excited about that. I know you're new to the board. You've been on for about a year, and it takes a little time to ramp up. But as we continue to move forward and really bringing to light the quality metrics and the Baldrige criteria and how we kind of want to set the tone and kind of setting the tone for our quality expectations. You're going to have a very influential role in that, and I'm excited about it.
Good.
So as just the last piece that I want to just go into is what, for nurses for individuals who are thinking about a career in nursing, what advice would you have for them?
A career in long-term
In
or
long-term
elderly?
Care. Yeah.
Education. That's one piece of advice. Always learn. I think, back when I was making career decisions, the nurse that chose to go the nursing home route or to take care of the elderly really didn't have it going on. Everybody wanted the ER, the OR, the hospital setting. Nobody went down that path, and I really respect any nurse who in her heart feels like she'd like to go that path.
Yeah.
And advice, stay strong. It's not for the weak.
Right.
You work awfully, awfully hard. That's why I wish when some of the regulatory changes had occurred not too long ago, and they were considering a nurse practitioner on site
Yeah.
as a requirement, I was sort of like this. I said, those nurses need that extra level of support and resource, because they're hanging out there alone in the middle of the night with a client that's having a change of condition.
Right.
And they're expected to take care of it expertly and perfectly, all alone.
Right. Do you have any regrets?
None. I really don't.
That's awesome.
I don't have any regrets. I used to pull my kids into the nursing home and make
That's how
beds.
I got to know them.
You're going to make beds this Saturday morning. I think it's good for you. And then interact.
Yeah.
And I would bring my grandson.
Yeah.
And let's sit in the living room and have a conversation with this 95-year-old. Throw the ball back and forth. And he remembers that.
Yeah.
But he doesn't really remember what grandma does.
Yeah. When you think about just big picture of the future of healthcare, what do you hope it looks like in the future?
That it survives, number one. That we can always provide care at different levels, at the level that the individuals need it to be. That's number one, that we survive all the threats that are upon us and coming. That's a big hope of mine. But I hope that the nurses and staff are helped at many different levels with information, resources, technology, and equipment. Because, you know, there's been a lot of change over my years.
Right.
You know. So I hope they have that. I hope we have enough people interested in taking care of the elderly in the future. But it's tough.
Yeah.
Hospitals are even experiencing the same dilemmas. And the hospitals were always a safe place. Everybody wanted to go there. They didn't suffer from low retention, difficulty recruiting. But they're there now. Yeah. Just like we've been suffering my whole career.
Yeah. Well, you know I'm an optimist. We'll figure it out.
We will. And
like
you will.
we always have.
I know.
But yeah, it's definitely.
Counting on it.
Healthcare is changing. The way we provide care is changing. But it's also a lot of pretty awesome stuff we get to do.
Yeah.
You know, think about even when I started my career, a person with a hip fracture was in the nursing home for at least 6 weeks. And today they have surgery and they're out of the hospital the same day.
Right. They don't even need you sometimes in rehab.
Think of how amazing that is for patients.
Yeah, when I started in nursing, a laminectomy, spinal surgery, repair the discs in the spine, they were on my unit for weeks. Weeks and log rolling them and very slow. When I started in the hospital in nursing, one of my responsibilities was to make sure that the residents who smoked had an ashtray.
Yeah.
And we had circle electric beds. There was a gentleman, equipment, nothing.
It's incredible.
Yeah.
And today, nurses have an iPhone that has so much AI technology in it that they don't even have to chart anymore.
I can't imagine.
Yeah, and as so much as at their fingertips. They do, for sure.
They need it.
Yeah, patients are more complex.
I was always hoping or wishing, I spent hours making rounds because I felt it was my responsibility to help the staff to identify a change of condition that needed attention.
Yeah.
And that I was staying on top of it. Hours making those rounds.
Yeah.
Well, why can't there be an algorithm that just makes it pop up in front of me? Why
Yeah,
do I have
as
to
you-
go search for it?
And as your time on the board, you're going to see it come to light
Good.
because it exists today.
Because I wish for that.
Yeah,
There's so
it's in
many
its
things that could
infancy,
be
but-
done more efficiently
Yeah.
and help the staff.
Yeah, for sure.
Definitely.
So the last question I have for you
Okay.
is, you think about the future of senior care in 20 years. We're 20 years into the future. What would you like to see radically change?
Okay, then I'll be 89. Maybe
You
here on
you
Earth.
said it, not me.
Yeah. And your organization will take care of me.
20 years from now, I got to think about it.
I
I'll be
think
getting
about
close to
that.
retirement.
Yeah. But I do think about it. This organization will end up taking care of me, perhaps, as I age. And what does that mean to me? And how do I want that to feel?
Yeah.
And I think you look for that answer in every customer you serve. So, yeah, I expect a lot. And so,
And so, what does that look like to you?
what does it look like? That someone will listen to me. Certainly, if I can't speak for myself, that there'll be some great advocacy. But I want to be heard, and I want people to listen. And I saw that in the evolution of the care of my family members, because I was taking care of them within the facilities on campus and within the Illuminus. I wasn't the nurse or the DON. I was the daughter or the sister. And a keen observer of how good we can do it, and sometimes how we make mistakes.
Yeah.
So I was blessed with that insight. But I think at the same level, I want the same things. I want to be heard.
The relationships, the human connection.
The connection.
Yeah.
Communication.
It's one of the
It's
greatest
so
parts
critical.
about working in this field is the human connections.
Yeah.
Well, thank you. This has
You're
been fun.
welcome.
I was
Good.
looking forward to this.
I
and
enjoyed
it's been a
too.
great time together.
Yeah.
And thank all of you for joining us here today.